Non-steroidal anti-inflammatory drugs, also abbreviate, or the acronym that we use is NSAIDs, are another class of non-opioid analgesics that are indicated for management of mild to possibly moderate pain. There are a number of drugs that fall into the NSAID category. Aspirin is one of them. It's the salicylate class. There are some other mechanisms of action of the various NSAID drugs. Ibuprofen is a propionic acid derivative. Celecoxib is a specific COX-2 inhibitor or cyclooxygenase 2 inhibitor. Ketorolac, which can be given intravenously. We think of the NSAIDs as mostly oral medications, and they are, but ketorolac can be given intravenously, is an acetic acid derivative. It's interesting that these all come from slightly different categories or classes of NSAIDs, but they similarly inhibit the pathway of the inflammatory response. They can inhibit the leukotriene pathway, the prostaglandin pathway, or both pathways, and so they interfere with the inflammatory response. Hence the name, anti-inflammatory drugs. And of course, they're not steroids, they're not glucocorticoids, so they are non-steroidal anti-inflammatory drugs. These drugs, the NSAIDs, block the enzyme cyclooxygenase, abbreviated as COX, and there's more than one subtype of the COX enzyme. COX-1 promotes the synthesis of prostaglandins that have a number of functions, including protecting our stomach and intestines, our kidneys. They help activate platelets for the clotting mechanism, and they also promote inflammation. The COX-2 subtype of cyclooxygenase promotes synthesis of prostaglandins that are involved in inflammation, but it doesn't synthesize prostaglandins that protect the gut or the kidneys. Most of the prostaglandins that are available to, most of the NSAIDs that are available to us are non-specific, meaning they will block both COX-1 and COX-2. So while they will block the prostaglandins that trigger inflammation, which is a good thing if we're hurting, they also block the prostaglandins that protect the gut, protect the kidneys, and so on. And that's not quite so good. It explains some of the adverse effects that the nonspecific NSAIDs have. There is one drug, celecoxib or Celebrex, that is specific to COX-2. What are they indicated for? As I said, mild pain to moderate pain. They're analgesics. They have anti-inflammatory effects. They also work for fever. And they can, aspirin, as we know, is prescribed as a platelet inhibitor because of the impact of aspirin on blocking the prostaglandins that activate platelets. So who shouldn't take NSAIDs? Well, anybody who's allergic to these drugs, and people can be allergic to aspirin. Anybody who's at an increased risk of bleeding because these interfere with platelet inhibition, and pregnancy, category C for the first 2 trimesters. The adverse effects stem from the inhibiting of the positive effects of prostaglandins. So the COX-1 subtype of cyclooxygenase produces prostaglandins that protect the stomach and the intestines, that protect the kidneys. Well, if you take an NSAID that inhibits those prostaglandins, you can end up with damage to the mucosa of the stomach, up to and including GI bleeding, and potentially acute kidney injury because of toxicity to the nephrons. Also, NSAIDs carry a black box warning of increased risk of MI and stroke. It is the the COX-2 specific NSAIDs that increase the risk of MI and stroke. Not so much a risk with the non-specific COX-1, COX-2, but with the specific COX-2 inhibitors. People can, of course, inadvertently or even intentionally overdose on NSAIDs. They're available over the counter, and a lot of people pop a lot of these pills to manage joint pain, back pain, whatever. And so we when they overdose on aspirin, because aspirin is acetylsalicylic acid, it's known as salicylate toxicity. And salicylates in toxic doses are they're damage the eighth cranial nerve. So people can experience tinnitus and hearing loss as a result of a salicylate overdose, or especially chronic overuse of the drug. There's a little bit more information about NSAIDs in chapter 44, and that you can get more information about what are the clinical manifestations of acute or chronic salicylate overdose. In addition to the tinnitus and hearing loss, people can have nausea and vomiting. They can also experience tachycardia, and their blood sugar levels can be either too high or too low. Treatment does involve stopping the salicylates, of course, and the person, if they have a really high blood level, may need to have dialysis to get rid of the toxic levels of the drug and protect their organs. Non-salicylate NSAIDs, non-aspirin NSAIDs, have similar effects for toxicity. The If a person is known to overdose on these drugs, they can be given activated charcoal in their stomach, and that charcoal helps to bind the drug and prevent it from being absorbed, and so it will prevent additional NSAID, either salicylate or non-salicylate, from being absorbed and only worsen the toxicity.